Hey guys, welcome back to another episode. Today we will be discussing how to manage OPD using the Dhanwantri system, which is used by all of the ESIC throughout India. So we'll follow the same steps. We'll be skipping on ahead until we log in. So if you have not watched the first video, I would suggest you go check it out. Alright, so once you log in, you can go to application health information system, and then the location and facility will be the same. And within clinical records, instead of going to inpatient and emergency, now we'll be going to doctor's work list. Once you click on that, this is your home page through which you'll be seeing your OPD. So the check-in date will be today's date, which is 29th of April 2025. Check-in number, I'll be explaining how to see that, and then insurance number or IP number you can see based on the patients, and the specialty, whichever you choose during your in the last page over here. During this over here, you chose surgical services, right? So you'll be getting that automatically selected for you. All right. So how do we read whatever is there over here? So the check-in number usually OP refers to outpatient. GEAS over here stands for general and abdominal surgery. And 290425 is today's date, so 29th of April 2025. And then 4 is the OPD token for a particular patient. So if you want to generate, if you want to check for a particular patient and you only know the number, then you can work your way back using the general formula, that is. So you have options to open either the mini case sheet or the whole case sheet for a particular patient. We'll be seeing both of them. Initially, if you click on the mini case sheet, a mini case sheet opens for you. So you can write the patient's chief complaints over here and remarks, similar to how we did in the inpatient. So we can say the patient has cold since 3 days. We can add the complaint over here. And whatever the basic examination part is there, we can add the examination part as well for a particular patient. And we can write the diagnosis for a particular patient. Now, suppose if cold is there, I can write sinusitis. It should be rhinosinusitis, but for example, I'm saying sinusitis, and then you can just provisional diagnosis, and then you can just add. And then after that, you can save this, and it will be it will show record saved successfully for this particular patient. Alright, and then you can click back over here in order to go back, and you can see the first patient whichever was there over here, he is gone. The number 4 is gone. In order to find that, you can go to consultant specific over here. Whichever OP you have seen already, it will be referred over here. You can see this is the green one, and once you click on this, the case sheet, you can see the complaints cold since 3 days, and the diagnosis of sinusitis has been added on this particular patient's details. If you want to open the whole of the case sheet, you can just click on this. This is also a hyperlink. Once you click on that, the whole case sheet opens for a particular patient. And then you can go ahead and write chief complaints from here, diagnosis from here, and then prescriptions you can prescribe from here as well. So the same way which we discussed in the last video, we'll be adding medications. Since the patient has cold, we'll be starting with levocetirizine. 5 mg, so the drug dose is 5 mg, duration let's say we're giving for 5 days, frequency at night, the quantity 5 number, and oral by month. You can click OK, and then you can see it saved it over here, and once you save it, it will show this confirmation message that record has been saved successfully. And now once you see for a particular patient, you can see, okay, I have prescribed this. Now, in some OPDs, you're supposed to give a printout of whatever investigations and medications you give, so that the patient can show that at the medicine counter or the lab counter, so that they can get the reports done, or they can, avail all of the medication. So you can do save and print instead of save and close. Once you do that, a new pop-up window will open, which will have the printed version of it. If you just give it a second, and Dhanwantri is struggling, but let's add CBC over here. We shall see. Same way, PDF should open. No, it has loaded properly. So this will have the patient, all of the details over here, and then the medication, and then whatever investigation we've given. And from here, you can just print out and give it to the patient. All right. So this is how you see a patient. And at the end of the day, we're supposed to clear those. You can directly go over here and then go to doctor's work list in order to go back to the menu, or you can go to back from here. Yeah, that's pretty much it. And then if you have to clear OP, you can just click on this. If the patient has not come in the description, if you just put a space bar over here and then save, that will count as you have seen the patient. Some places require you to clear the OP instead of canceling all of the OP tickets so that it shows up over here. Over time, over the day, when OP starts, and then at the ending of the day, you will see all of these, whatever it is there. And once everything is empty, you'll get a token over here saying no OP available for today. This intra-department referral currently does not work in our system, so that's why it's giving an error. And if you want to see whether any new OP has come or not, because OPs will be continuously generating, you can click on this refresh button so that newer patient can be added in the list. That's it for now. I'll see you in the next one. Thank you. Bye-bye.